Why don't we just go ahead and we'll have you just introduce us to lymphedema. If you can explain to us, as Matt asked, what is what is lymphedema and how does it develop?
Yeah, so lymphedema is actually just essentially, if we bring it down to the basic levels, it's a chronic swelling, and it's not just fluid, it's not just water in the body. It's actually a protein-rich fluid that builds up. It's from the lymphatic system itself when that system is no longer able to clear. Um, and then that lymph fluid, if you think about your lymphatic system, basically it is the body's clearance way for toxins, and it runs right along the circulatory system. Most people that become familiar with lymphedema, it's most common when you have someone who has breast cancer and they have lymph nodes removed, and suddenly they get swelling in that arm next to the breast that was being treated for the cancer. That's what most people will see with lymphedema when they don't have something else causing it, right? Um, but it can be difficult to diagnose. There's lymphedema, lipedema, chronic venous insufficiency, and then cardiac related edema too. And a lot of those present similarly. So, lipedema, it's like a collection of excess fatty tissue, right? Beyond just having like an overweight diagnosis, right? Chronic venous insufficiency, for a lot of people, when they have that, they have, their legs, they get red, they get swollen, the blood flow is not as good. And that can sometimes mimic lymphedema as well. With lymphedema, again, your swelling, it can affect the blood flow because it runs right next to that cardiac system, the circulatory system. So it does take uh, a doctor who's familiar with it, a lymphedema therapist, someone who's familiar to be able to truly diagnose it. Um, and then once you have a diagnosis, that's certainly helpful for getting services, but we'll go into that as well.
So
But
if I could ask, the lymphedema though is the lymphatic system is we've all familiar you have lymph nodes throughout your body,
yes.
and in a brief layman's terms, what is the function of the lymph nodes in the body?
Yeah, so the lymph nodes, they help to clear some of that, like um the toxins, general fluid. If you've ever gotten sick, sinus infection, things like that, the doctor will often palpate at the neck. And sometimes when you're sick, those lymph nodes that are trying to get rid of the toxins, you can feel them. That's usually where most people can eventually feel a lymph node, right? Is if they're sick, you can feel them in the neck. Um, and so lymph lymphedema, when that occurs, that lymphatic system that's supposed to clear the toxins, it has basically a block somewhere. There's a interruption in that body's ability to circulate the lymph fluid and then clear it out. And so that block, that's when you start to see the swelling. So, you said about your ankles, right? There's some kind of block somewhere that is keeping that fluid down at the lower part of your body rather than allowing it to circulate through and come out.
And for those of us who have the inclusion body myositis, uh, my understanding is that the muscles in our legs uh, facilitate the movement of that lymphatic fluid. And when those muscles atrophy, they no longer have the ability to be effective in that. Is that correct? That then that causes or is a component, if you will, of why you get the swelling in your ankles and your legs and your calves.
Yeah,
That's okay?
there's different causes in general, but when it comes to myositis, yes, that weakening of the muscles. If you think about um for your heart, right? Your doctor tells you to move, start walking, things like that, right? And it's because your legs, those calf muscles will help to pump and circulate fluid better for you, circulate your blood. With lymphedema, it's actually a very similar thing when you're walking, or even without lymphedema, just your lymph system in general. when you're walking, those calf muscles, they'll kind of squeeze on the lymph nodes and the lymphatic vessels lower in the legs, and it'll help to pump that fluid up so that it can clear. But when the muscles become weak and you're no longer getting that pumping action from them, then that movement isn't happening that way. So a lot of times, if you start to get swelling, the first thing they recommend, if you can't do just like the exercise and get the pumping going, they're going to recommend that you elevate. Now, the reason for that is because gravity should pull that fluid if your legs are elevated, right? Your head's down here, your knees, and then your feet, right? Everything's elevated. Gravity should pull that fluid back down to about your abdominal region, and then once things are flat, your cardiac system can help to take care of assisting that lymphatic system and clearing the fluid. However, eventually with lymphedema, because it's no longer just fluid, it's no longer just edema, it becomes that protein rich fluid. It doesn't move as well. It doesn't respond just to gravity's effect pulling it down. And that's kind of part of the reason why it needs a special type of treatment. And so when you do talk to someone who can diagnose it, there's different things they're gonna look for. Very rarely do people get an actual imaging test. There are different imaging tests out there to diagnose it. Usually it's based on physical exam, past medical history review, even what they call a Stemmer's sign, which is, on the toes or the hands. You're basically pinching right beyond the toes. If that skin pinches up, okay, it might just be edema, it might not be lymphedema, but as the stages of lymphedema go on, when they do that pinch, they eventually won't get any type of movement. That skin is firm, it's so stretched out from the fluid. There's no pinch available to happen. They call that one the Stemmer's sign. But again, just if you have concerns about it, if you think you might have it, getting that diagnosis is going to be really helpful. And we'll kind of talk about why that is in just a little bit.
One of the things that I would like to share here with the other veterans is that I have lymphedema, and I am rated at a 10% disability for lymphedema. And so for any of you who are experiencing that swelling in the lower legs and the ankles, if you have not done so already and find it necessary to put a claim in for lymphedema, it is a service-connected disability when it's attributed to perhaps, in my case it was diabetes, and and we put a claim in for the lymphedema, and indeed uh, I went through the exam and was given a 10% disability. So it's something to keep in mind for all of us, or any of the us veterans that have the swelling in the lower legs and the ankles. That's it is something where you can get a disability rating for.
It's good to know. Thank you. Um, so there's different types of lymphedema, right? Primary, you can actually be born with lymphedema, and you may not notice it until some kind of stressful event happens to your body. There's secondary lymphedema, which is kind of what's going on with myositis, right? There's something happening with the body, and then lymphedema develops as a secondary comorbidity. And then you can get, post-surgical or traumatic edema, and depending on, like you said, yours may have come on from diabetes, but let's say you had an abdominal surgery, that scar tissue can sometimes block lymphatic flow, and that can cause lymphedema in the legs or the abdomen as well.
Mhm.
If you've had any injuries during your service time to your legs, whether it's, something like a gunshot wound or something else that causes a lot of scar tissue, that as well can cause lymphedema. And then there's different severity levels of it and different stages as well. Stage 0 with lymphedema, it's actually, you can't see it. We kind of compare it to like a dish sponge. The dish sponge, when it's dry, when there's no water in it, it's pretty lightweight, it keeps its shape. When you get that dish sponge wet, it might still look the same size, but it's a lot heavier feeling, right? So that's stage 0, where feels heavy, might feel a little stiff, but you can't see anything going on with it. And that stage is a reversible stage, right? You can address it, you can do work to it to get it to kind of reverse. With myositis, we know, myositis is progressive. So for stage 0 in myositis, it might be a matter of catching things early and then trying to prevent where it goes through the other stages. Stage 1 of lymphedema, that's where you're still kind of responding to that elevation because the gravity is going to help that fluid's not as protein rich at that point. Um, Stage 2, not really, elevation's not really responding or affecting it as much as it was before. You might get, when you go to push at the skin, it may not rebound or push in and come back out as much as it was before. It might get a little bit tough. And then stage 3 is the really significant lymphedema, right? You get creases in the skin, a much larger limb. You might classify it as like elephantiasis or different things, but basically a lot larger creases. The skin is kind of looking a decent bit different, especially in the legs. We see changes to the skin texture, as well as the swelling itself. Not so much if you're someone who's affected in the upper body, with the muscle weakness there. We don't tend to see as much of the skin change, but we do see, the increased size of the limb, maybe some of the skin creases from the fluid filling up.
And other than elevation, what is the most effective treatment for lymphedema?
Yeah, awesome question. So for lymphedema itself, it's called complete decongestive therapy or CDT, and there's 5 components to that. So there's manual lymphatic drainage. That's where you have someone like a lymphedema therapist come in, and they're gonna do a special type of massage. It's different than any other kind of massage that you would feel, but it's targeted at encouraging that lymph system, all of those lymph nodes and lymph vessels, to move that fluid throughout the body since it's not doing it on its own. And then after you would have that session of manual lymphatic drainage, you would be wrapped with these short stretch compression bandaging. And what those are awesome to use. They're awesome to use because it's not like an ACE bandage where it stretches a whole bunch. It only has a little bit of stretch to it. So if you're getting fluid fill up or backflow, that bandaging, because it doesn't stretch much, it keeps that containment pretty nice. It doesn't allow your skin to expand a whole bunch as that fluid's filling back in. So all that work that was done with the manual lymphatic drainage to clear, you can kind of keep it cleared as you're wrapping, right, with a short stretch compression bandaging. The goal is down the line, once things kind of stabilize, you get the volume reduced, then you get moved into more of like a permanent type of garment. So I think everyone's probably familiar with some kind of compression garment. They're pretty popular now. A lot of people are wearing them, even just nurses working in the hospitals. But when it comes to lymphedema, a lot of times it's maybe a custom fit garment that someone measures you for, and it's meant that when you have that garment, it should be much easier than managing the short stretch bandaging, because you're not wrapping the limb with all of this bandaging material. You're really just sliding on a sleeve. Sometimes they make it really easy where it's Velcro straps that kind of go around, and so you can tighten one at a time. It's come a long way, and they're trying really hard to make compression garments much easier to put on and take off.
Yeah,
And
I have used compression socks before, and it takes a committee to put those things on. I gave up on it. I was just, but one of the things that I will add is that when 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 I was diagnosed with lymphedema, uh, my ankles were pretty swollen, and when we are immobile, as we are with myositis, we will spend most of the time, in a seated position, and our muscles don't move to move that lymphatic fluid, and our ankles swell up as a result. In my case, um, it started affecting the skin. The skin started to uh, it doesn't stretch as much as it should with that. And what I got, the doctor said, I went to a dermatologist, and he said it's just what they call dermatitis.
Mm.
And the dermatitis, he said, oh, this is from your socks rubbing because the ankle has swollen up so much that it rubbed the skin, and it was as irritating as can be. It itched like crazy, and uh, so if you have that itch on your legs or your ankles, it's a sign that it could be from the lymphedema. And they gave me an ointment, and it worked well. But it's all a side effect, and it's a progressive thing. You get the myositis, you get the lymphedema, you get the dermatitis, and it's a progressive stage of secondary, annoyances, if you will, with these things. But that's what happened in my case. And so when you have that, if you go through that, Nicole, um, is this something that can lymphedema be cured, or is it something that will remain with us indefinitely?
Yeah, so really good question. Lymphedema, we talked about those stages 0 through 3. 0 is that kind of reversible stage, but if it's being brought on because of the muscle weakness that's progressive, most likely you're going to progress into some of the other stages. If you're really good about catching it early and treating it proper, right? With this CDT method, it can be stabilized. It can be very manageable, but most likely you're going to be dealing with that long term. And I'm glad you brought that up because part of this complete decongestive therapy is skincare as well, right? So you're trying to keep the skin very, very clean. You're trying to use moisturizers and lotions because that skin is stretching so much. You want it to be elastic, right? As lymphedema progresses, it does become more fibrotic, more firm. And so part of the maintenance, right, trying to use those compression garments to prevent it from continuing to grow and stretch that skin and do damage to those vessels. If you can be really good about your management of it, hopefully it won't transition into that dermatitis. Beyond that, the other thing to watch for is because that lymphatic fluid carries out some of those toxins in the body, you're at a high risk for infection, right? So we always tell people, oh man, don't ever use your fingernails. If it's itchy, try to use your knuckle to scratch, or try to just like pat the area, right? Don't actually scratch it. You have so much bacteria underneath the nails that if you open up that skin, the circulation's not good and the lymphatic fluid is staying. You become really high risk for what they call cellulitis, right? That's a specific type of infection. Um, and so with lymphedema, you might notice that the skin is red. It should not be hot to touch, right? So if you're monitoring that area and you have some redness, okay. But if it becomes almost like a localized fever, that's not so good, right? Fever, pain in the area, those are things we really want to watch out for. That's when you want to get checked. That might be more of infection rather than just the redness from the change in your blood flow.
Would if one suspects that they have lymphedema or any of the what I'll refer to as the secondary byproducts of lymphedema, the skin situation there, should they go to a dermatologist or to another specialist?
Well, a dermatologist is going to be a good way if you're feeling like you're getting like the skin side effects from it. The dermatologist is going to be a good option for you. If you think you have it, even before it gets to that point, um, the first thing is to talk to your doctor and try to get a diagnosis for it. If you have that diagnosis, that opens up some other paths for you. Seeing a lymphedema therapist, getting compression garments approved by insurance, and then also eventually, um, once you're at a really good stage, we can try to get you what they call like lymphatic pumps, right? So instead of someone coming in and constantly doing the manual drainage for you, they make these pumps with different chambers that can actually pump the fluid and help to circulate it, since that muscle pump action isn't happening anymore.
I see. Okay.
Those can be really helpful, yeah, but that's the big thing is trying to get it diagnosed as early as possible so it can be treated in the earlier stages before
Of
you get
course. Yeah. Thank you. Okay, Greg and Lori, welcome again, and you have a question. Go ahead and unmute yourself if you would, Lori, so we can hear you.
Takes a second to get me unmuted.
There you go.
We did want to just let everybody know, maybe it will be helpful to somebody else. His feet and ankles are huge, and the VA was able to sent us to a person that measured him for the compression stockings. And then they also gave us one of the devices that she was talking about, where we put it on his leg. It's from Tactile Medical, and it's called a Flexi Touch Plus. It's a full leg compression. It has different chambers where it massages his legs. Pneumatic. He said it's pneumatic. He said we run it for 45 minutes each day. The VA paid for the equipment for him. It massages his legs and helps take that the fluid level down. And then also there is something called a doff and donner. You mentioned that you don't like to wear the compression garments because they're so difficult to get on, and his were measured specific for him. And I remember the first time they gave them to us, it was about 15 years ago or so. And I thought, these have to be the wrong size. There's no way you can put these on. Well, now I'm a pro at it, but there's a doff and donner device that helps you put the socks on. A caregiver would have to do it. You wouldn't be able to do it yourself, but it goes onto a big, I don't know, you put the sock over kind of a tube, and then there's like a rolly thing that's rubber. You put it on it and it rolls it up, and you put it on his feet and it just rolls right up his leg, even though they're that tight and that small. And again, the VA paid for all of that. We got the Doff and Donner device
Wonderful.
from the VA, and also the device that compresses. He said it's called Flexi Touch Plus, and it was through Tactile Medical. Was that everything?
Wonderful. It's great to hear that the VA is taking care of you in that manner. And so for all of us here, if you're at that point, again, this kind of help is available through the VA health administration, through your hospitals. So, Lori, thank you. We hope that's right, because I know I've seen those things. I was in the hospital once. They put those on my legs, and it's like a big balloon that inflates and presses in, and it's so I'm familiar with it, but I'm glad you've got that to help you through the day. Then, Kevin, you've got your hand up there. Go ahead, please.
Hey, Jim. Hey, Nicole. I just wanted to invite Nicole if she wants to speak about my case. I have no hesitations on HIPAA restrictions or anything, but I do want to say that I struggled with lymphedema for many, many years, and finally when Nicole came around, I was able to take care of all the dried skin patches and ulcers and all the bubbly skin and all that on my legs. It cleared up with the manual lymph drainage, which is very hard to get, but the VA is paying for it. So I just want to say that's a very successful treatment on my case, manual lymph drainage. And I'm looking forward to. I'm getting a pump garment right now. I have a 12-chamber pump, and I'm waiting for my garment to come in, which will mean that I don't have to do the manual lymph drainage every day. I can use the pump for that. And I have a very high-end pump that the VA bought for me, and it has 12 chambers in it. And you can imagine the specificity of when it's pumping your legs. It goes to each section of your legs, and with 12 chambers. The old pumps were 3 chambers. They were very gross, and you had a lot of backflow in them. But this new pump built by LymphaPress is, I'm looking forward to getting that thing up and running when I get my garment. And yeah, go on, Nicole. Go ahead and talk about my case if you want. No restrictions. All the progress you made, I really appreciate it.
Thanks, Kevin. I appreciate that permission. Yeah, so I've been working with Kevin for a couple months now. He's while we're waiting for his garments, we've fit him and did the garment measurements, but in this time we've been using those short stretch compression bandages, and they're not easy to put on, to have the caregivers carry over. It does take a good bit of training. So when you can get fitted for those compression garments that are special to you, it makes a huge difference. And then, like you said, that that first pump, the 3 chamber, it's really not sufficient enough. Even in the hospital, in if it's just the ankles, you might be able to get away with certain garments they put on. But anytime that lymphedema becomes more advanced, you want a quality pneumatic pump that's going to push that fluid along the proper channels. The lymph system itself is pretty specific in the pathways that you're supposed to move that fluid. So these specialty designed pneumatic pumps are pretty special with how they do what they do. But
Now,
yeah, go ahead.
yeah, Nicole, let me ask this. When you say a pump, is this an external device, or is this somehow injected, or what are the mechanics behind this pump?
Yeah, good question. So it's external. A lot of them are going to look like maybe a sleeve that you put over your leg, almost like a pair of pants, right? Or if you're having any swelling in the arm, because maybe that's the area that's gotten weak. Same thing. It's going to look like you're putting a sleeve over your arm. And then ideally, the position you would be in when you're using um, that pneumatic pump, ideally you want to be lying down with your legs again in a slightly elevated position just to kind of help it along. But it's going to start, there's different functions for it that you can set. Some of them have like a pre-clearance pathway, which is really good because you're trying to open up other areas of the lymphatic system to accept all that excess fluid that's coming its way. So they might pre-clear those areas and then start low and kind of pump the fluid. If this is the feet, because we're elevated, it's going to slowly start to pump that fluid in different pathways to get it up toward the torso. And eventually there's a pathway with the lymphatic system where you'll actually urinate the extra fluid out of the body. So when you do receive manual lymphatic drainage or you're using those pneumatic pumps, you should have to urinate afterward. That means that your body's processed the fluid and it's actually exited the body.
Thank you.
You're welcome.
Roland, Merry Christmas to you. You have a question. Go ahead and unmute yourself, Roland, so we can hear you.
Okay.
There you go.
Merry Christmas to you also. Merry Christmas to everyone. I just wanted to interject that the compression socks that you were talking about that are tough to get on your legs and everything, I went through this process at the beginning and I couldn't find the compression socks that I could put on. And I had a nurse that came and saw me and she lost tremendous amount of weight and she had to use compression socks. And she told me, go on Amazon and go in another section of the socks, and they have larger socks that are designed for people with the big fat legs and everything. And she says, go and get the larger size socks and you'll be able to get them on your legs. I went in, I checked the size, I got the larger size socks. Son of a gun, I was able to get them on my legs, and it has helped out tremendously. And the other thing you're talking about having a pump, my personal pump is my wife. My wife massages my legs tremendously. And I think you're laughing because you know exactly what I'm talking about. And she massages my legs from the ankles up to the knees. And she goes back and forth and she does it twice a day. She does it in the morning when I'm ready to get out of bed, and she does it when I go to bed at night. And just that massage that she does has taken the swelling away from my ankles and the lower part of my legs, which is thankful because I was getting so itchy and I was starting to develop blisters on my skin. And since she started massaging my legs, it solved the problem tremendously.
You got to love the caregivers and the
Oh, I
spouses.
wish I could get my darn stupid percentage up because I need help with my wife. My wife has multiple sclerosis, and I helped correct that years ago, getting her on the right profit.
Roland, are you benefiting from the family caregiver stipend, the PCAFC program?
No, I get I'm on hospice. I'm on hospice right now. The hospice comes in to see me twice a week.
What is, are do you have a disability rating through the VA?
The rating that I have is geared upon my hearing, and they give me 40%, uh, 30% for hearing and 10% for tinnitus. And they give me a total of about 50%. That's about it. And they're
Okay.
trying to get me up above that. I talked to the VSO guy, and he said that you got to get you up to at least 70%.
Yeah.
We can get some help for your wife and help
Yep.
you more. I mean, I
Yeah.
got a lot of stuff in the VA. I have no bitches with what I've gotten from them, but I'm like at a standstill right now. I need information from you. I'm going to send you an email, and I need more information from you that you can send me. But
You let me know. We'll do everything we can to help you.
yeah, but I'll tell you, this organization you started with this thing that we're on today is the best thing I ever got in on because I have learned more from you and what I hear from everybody else. It's just been fantastic. And I wish we could get all the VA guys to get on this thing because this is fantastic.
Well, that's very kind words, and I'm very grateful for that. But I got to tell you, we're here as a group, and we have a tremendous resource of information, and I will uh, say without hesitation that this group of us is the best source of information for inclusion body myositis and the VA disability program, the appeals and claims anywhere in the country. We are
Exactly.
the absolute best resource
Yeah.
that you can find.
And my
So
biggest
thank
hassle
you for
right
that.
now, and my big hassle right now is that my myositis has decreased to the point where I'm losing the dexterity. I have hardly any movement to my arms, and I can't grip anything anymore. I have to go into that mechanism that you said the VA has approved where it can control my fingers so I can grab something and hold it. Because right now I can't close my hand at all. My fingers stay straight and I'm losing the
It's
dexterity of my hands.
that's about as far as I can make it
Yeah.
here. But yeah, it's all there. And you give me send me an email, give me a call, and
Okay.
we'll go from that
I'll
point.
gladly do that because I'm at a point where I'm stuck. I'm in with the lawyers. I'm in with Hills and Ponton. They're
Okay.
receiving some of my information and everything.
You're in the best place you can be then if with
So
them.
I'm working both angles of the thing.
Yeah, I got you. I hear you.
And I was diagnosed in the early 2000s, and around 2010. So it took 2 years to diagnose me. And I
Yeah.
ended up with a doctor in Augusta, Georgia, and that's the only way I finally got approved
Yeah,
to. Yeah,
it's a long and arduous journey.
it is. It's
No
tremendous.
question about it.
Yeah, I appreciate everything that people have passed on for information. It's just been fantastic, really.
It's a great group of people we have here,
It
no
is.
question about it.
It really
Matt,
is. Thank
how are
you.
you?
Excellent. Hey, I just got a little tidbit for those of you who are having problems with compression socks. My daughter is a nurse, and the secret to putting compression socks on is save your bread bags. You know, the plastic bag that your bread comes in? Your caregiver slides it over your foot. Then she takes the compression sock and puts it on your toes, and it slides right up your legs like nothing. You reach to the toe hole and pull the plastic bag out, and you're done.
There you go. There you go. Any tips that we have tremendous creativity about save your garbage, guys. You're never going to be able to put your socks on without it. So, Kevin or Matt, thank you for that. There's yeah, a lot of those tips and tricks from personal experiences really does help. Um, Matt, did you have anything in addition?
No, I just wanted to give that little tidbit. It helps. Like I said, I'd go in for a procedure at the hospital, and the nurses would just
Mm.
take the bags out of or take the socks out of the bag, or take the compression thing out of the bag, slide the bag over your foot, slide the sock right up. I mean, it was slicker than snot.
I'll be damned.
Yeah, just I mean, it slides right up, and then all you got to do is reach to the toe hole and pull the bag back out. If you're having trouble, give it a try. I can't do it myself because I
So
can't get
basically,
my foot up this high.
you're taking the factory seal, the wrapper there, and making it a tubular kind of a structure.
Yeah, you just slide it. It's because the hard part is once it's over your foot, up the leg is easy, but it's getting it over the toes and the foot because of the way the foot's configured. With the plastic bag, it slides right over. It takes about, I swear to God, you can put them on in 3 seconds.
Honest to God. Great
Yep.
tip. Great tip. Thank you, Matt.
Uh-huh.
Kevin, Merry Christmas and good morning to you.
Good morning, Jim.
Yeah.
Good morning, everybody. I wanted to second something that Roland just mentioned, but first and foremost, I want to say hello to my new friends, Lori and Greg out there in Oregon. It is really, really great to see them dialed in today. And Jim, I want to thank you for synchronizing that, making that happen. That's a big deal. Uh, helping each other here. Uh, what I wanted to share with the group is that I am a federal employee. So I was on furlough for 6, almost 7 weeks. And I'm a very, very curious individual, and I like to learn more about inclusion body myositis. So I did a lot of research. What I did was I downloaded all of the Board of Veterans Appeals cases from the year I was diagnosed in 2018 all the way to the present day in 2025. And what Roland mentioned earlier about Jim, your organization, SUDS, all the individuals that have educated not only us, but educated the VA, educated whoever it is in the community, getting those letters from Dr. Cohen, that it is crystal clear to me when I look at the research that this organization right here has been a focal point in changing the paradigm. And the paradigm really pivoted around 2022. That, at least that's what the data shows, when everybody became aware of the letters of Dr. Cohen, and I forget the name of the other doctor. But this
Tom
particular,
Lloyd.
yeah, and Tom Lloyd. But this particular group right here is very, very effective. And I have to, tip my hat to the generation of Vietnam veterans that have really fought the fight, because I think there's going to be light at the end of the tunnel. And I just had to say my piece on that, Jim, as we head into the holiday season. Over.
We appreciate that, Kevin. Thank you so much for those kind words. Indeed, it is. It's a magnificent group of people we have here. And with that said, um, let me bring you up to speed on a development here that is what we've been working for the last 5 or 6 years. And that is that through the letters that have been written, and I can't even, it's over 110 letters that we've written to our congressmen and our senators, and also directly to the VA. And we have pleaded for recognition, for them to acknowledge this disease. And Augie, who is not here today, believe it or not, received a response. And the response came from the VA and informed us that they have requested a panel to be assembled by the National Academies of Science, Engineering, and Medicine to review the causes, I emphasize the causes, of many different diseases, one of which is inclusion body myositis. The purpose is to make IBM presumptive. This is what we have been struggling for 5 years. This has been the ultimate goal, to get IBM to be a presumptive disability where we no longer have to fight this claims process and denials. And you have it, it's presumed to have been caused by your military service. It is going to happen. We have inundated the VA with letters. Alicia has, Augie has, I have, Suds has. Many of us have written these letters directly to the VA, and we have finally annoyed them to the point where they're taking action. And this is the action that we've wanted. Our ultimate goal, my ultimate goal, was to get Title 38, Section 3.318 changed to modified to include inclusion body myositis. That is the rule. That is the rule that gives ALS veterans total disability and a presumptive status. That ALS was caused by their military service. We're trying to get IBM included in that, and oh, forgive me here. Somebody's trying to call me, and I don't want to talk to them. But we're trying to get IBM included in that. And this panel is underway now. Now, here's the kicker. As you know, I have a pretty close relationship with Todd Cohen out of the University of North Carolina. Todd Cohen has been working on a massive research thing to do that very same thing, to find out what is being caused. What are the causes of IBM, and done so in analyzing the toxic environmental exposures. He has worked with two PhD scientists, one of which is Julia. Forgive me, I can't recall her last name. The other PhD scientist that is working with is Brittany Krzyzanowski, and they have specialized in researching environmental toxins and the diseases they cause. These people could not be better picked for this panel. I spoke directly with the director of the National Academies of Science, Engineering, and Medicine, and told them to get these people on the panel. And I just heard from Brittany. She said she's in. And I have talked to Brittany several times. She knows what we're struggling for. She knows IBM. She knows that our need is presumption with the VA to get a presumptive service connected. She is now on the panel. We have one of our own on that panel. The only thing that drives me out of my mind is the VA requested from the National Academies that the results of their findings, they would like to have, and this is their wording, no earlier than July of 2027. So even if they come to a decision tomorrow, the VA doesn't want to hear about it for another year, a year and a half. But the bottom line is it's gotten to the National Academies. It's under review. IBM, with a few other diseases, is going to be, we're pretty confident, is going to be labeled as a presumptive disability now. This is what we've been fighting for, and it's underway. And we're very happy to say that we have handpicked the people that are on that panel. And so I think it's going to be a massive benefit for us in the long run. Alicia, good morning to you. How are you, dear?
I'm doing well. Thank you. Merry Christmas to everyone. And yay, we are making progress. Great news. Nicole, this is for you. And I want to thank you so much for your time. Great idea, Kevin, to recommend this. Do you have any special massage techniques, or is there a recommended way to proceed with that? What tips can you have on helping us move that fluid?
Awesome question. So what I can say is you want to always be moving that fluid and massaging in an upward pattern, right? So if you're swollen at the foot and the ankle, you don't want to massage up and down, right? You always want to start low and massage up. It's different depending on what other things you have going on. For example, when I've been working with Kevin, He has some other areas that are maybe blocked because of abdominal surgeries and things like that. So we kind of have to reroute his fluid in a couple different ways. But basically, if you're just swollen at the ankles, you're trying to massage that fluid up the leg, kind of toward the groin. There's a large collection of lymphatic vessels there that can help to take up some of that fluid and help to clear it. But you're just trying to get it basically closer to the abdominal region, closer to the heart, so that your body can do what it's supposed to do in those areas.
Okay. And are you squeezing and moving, or are you like using your knuckles and move? What's the most effective method?
Yeah, good question. So the lymphatic vessels, they're pretty superficial. They sit just under the skin. You're not trying to do any deep pressure like down into the muscle
Okay.
belly itself. So for example, if I'm massaging this area and trying to move it up, I would do like a semicircle, like half a circle, right? I kind of want to push
Okay.
like that. And my goal is not just to push and move, right? My goal is to actually get that skin to
Circles.
move and stretch. And I try to use as much of the surface of my hand as I can, right? Pretty even pressure. And I'm just moving up the limb, whether it's the leg,
Okay.
arm, and you're moving slowly, right? You're not going real fast. And if you get that skin to move, you get that skin to stretch, it's going to be harder in those areas that are very swollen and fibrous. But again, you're not digging in real far. Now, for those areas, if they are really, really tough, if they're really firm, you can actually do just like a prolonged pressure, right? You can just kind of hold that area. You can push in with your fingertips, and it kind of seems like the exact opposite of what I'm telling you on the massage part. And it is, but basically when you hold that pressure there for 10 or 15 seconds and then you release, when you go to massage that area, you're going to notice that that fluid feels much more like fluid than a firm, solid, um, it's that protein, right? So it's going to feel more mobile so that when you do go back to your massage after that pressure, you're going to be able to move that fluid as well.
Okay, good. Thank you.
You're welcome. Great question.
And Suds, good morning to you again.
Good morning and happy holidays to everybody. Another one for you, Nicole. And thanks for helping Kevin out. We appreciate that, and I know we appreciate you coming on today. I've got the BioTab pump here that I've been using since probably 2008 or 9. My lymphedema, and I go to the podiatrist and I go to a lymphedema expert here in Milwaukee, but I keep having like 2 pressure points on my left foot, like right by the heel and also up by the big toe, and also on the right foot by the pinky toe. And they've given me Urea 20 cream, I believe it's what it's called, to putting on that. Is there any other creams or lotions that, I've got all the other body lotions and stuff like that after you're out of the shower, but are there any other specific creams for pressure points where, the skin is really getting stretched and then
So that's a good question. What I will say is technically a cream can be considered a medication as well. So it would have to direct you to your doctor, but beyond just the cream, you could consider if that pump that you have is highly adjustable, and some of them nowadays are, you might be able to have someone from the company come in and adjust specific chambers on it so that you're
Okay.
not putting as much pressure on those points. And if the one that you have isn't very adjustable, at this point you might be due for, another evaluation and see if you can get one of the newer pumps that do have more of that ability.
Yeah. And, since I'm like most of the guys that can't move around anymore because I don't walk, the question is, I don't feel the pain except when like I'm in bed at night, and when I go to turn, I have one leg that my wife will lift up, and then because I sleep on my right side, but and I understand maybe that's why the pressure points from those feet are on top of each other and but then I can't move my legs anymore unless somebody comes in and physically moves them down for me. So is
Yeah,
that
yeah. So even your positioning, right, in bed, if you can, because anything that's going to create pressure, it doesn't matter whether it's the mattress, eventually pressure is going to create those sore spots.
yep.
It's a really easy spot to get that pressure from. But if, do you lie on your side much, or are you mostly on your back? What do you?
I start out when I get in bed when my caregiver gets me in bed at night. I usually am on my back from anywhere from a half an hour to 45 minutes. And then when Nancy comes in, when I'm getting ready to go to sleep or watch the end of a game or something, then I'll turn on my right side. She'll help me turn on my right side. And then
So,
that's when then I'll ask her to move my one leg up, kind of move it up. So maybe but I can't have her come down in the middle of the night and readjust everything all the time because that'll interrupt her sleep. So.
right. What I would encourage is use some pillows, right? So if you're on your back and you have a pillow that runs along your calves but doesn't touch your heels, right? So your heels are gonna, I don't know if that's working because my camera blurs the background, but so if this part of my fingers right here is your feet and your heels, you're gonna
Mhm.
keep the pillow basically right here so that your heels are just floating, nothing but air touching them. So you might have to use two pillows, right? Because the weight of your legs might compress the ones that you're still getting pressure from the mattress on your heels. But if you
Okay.
keep those heels, that's one of the most common things we use in home health to prevent pressure sores on the heels. They're really common. And then when you roll to the side, you also want those pillows between your legs, running the whole length of your legs so that your ankles aren't touching, right? Your knees aren't touching. None of those bony areas are touching.
Mhm.
Ideally, because you're getting these sore pressure points, we would have you rolling off of that side within maybe 2 hours, but that's really hard at night. I know that
Yeah, because I physically can't do that anymore. So.
exactly. So, I mean, if you cannot do that, you can maybe talk to the VA about trying to get a certain type of mattress that is, so they have these air mattresses that have chambers in them, and slowly they'll inflate one chamber, and then deflate, and it basically creates different pressure fluctuating
Mhm.
throughout the body at night. And that helps to prevent some of those pressure sores as well because the pressure is always changing.
Okay. Thank you very much. Thanks for being here today.
Thank you.
All righty. That's some great questions here. Nicole, you have enlightened us wonderfully here about why my ankles itch, and but the health aspects of that lymphedema are serious, and indeed we're so very grateful for you being here to share with us some of the things we should be aware of and how to treat it. Are there any other questions for Nicole? Uh, is there anything else, Nicole, that you would like to add?
Well, thanks for having me, first of all. Second, like I said, if you can get a diagnosis or you can get someone to come out and assess you, it's really helpful because everybody's different. A lot of people aren't just dealing with myositis. So if they have someone that can come in and assess all of these nuances, right? The pressure points, different areas of swelling, the other comorbidities that can, result in it. Like I said with Kevin, we have to be kind of creative with the way we move his fluid so that the body can process it safely. So it's really important to get the right referrals and to address it sooner rather than later. You can always address it, but the earlier you get moving on it, the better chance you have of making it more manageable.
Yeah, there's a little message here from Lori Ruthman. She said it's called a ProBed that you're referring to that inflates. Lori, was that correct? Go ahead and unmute yourself, Lori, and um, you can talk to us here.
Oh, okay. I thought I'd just put it in the chat, but I didn't get away with it. He has a pro bed. It's actually about a $40,000 bed, but he was approved for that. The VA paid for it. It's an amazing bed because it actually helps the caregiver too with my back and things, but it'll raise, lower, it tilts each direction. The head will raise, the feet will raise, but then it also it inflates in order to turn him up onto each side, and it will go up to 30 degrees each direction.
Oh
And
my.
we have his programmed at 25 degrees, right? On each side. And then he'll stay on one side for 20 minutes. He goes to his back for 5 minutes. He goes to the other side for 20 minutes. And it does that throughout the night.
It has bolsters for your legs.
It has bolsters for your legs to be able to, like what she was talking about, raise the legs a little bit, and it relieves the pressure points so that he doesn't get any decubitus ulcers on his heels. There's also bolsters for his arms, which we didn't find super helpful, so I just propped them up on pillows to keep him from getting pinched near his sides. But it's an amazing bed. The first day he tried it, he said, "I'm not getting in that thing ever again," because he wasn't used to it. But after he used it, we did try it again.
Takes a while.
It takes a little bit to get used to, but now he can't sleep in anything else. So it's hard for us to travel. He did go down to Arizona at one point and got stem cell treatments. And this was a couple of years ago. We actually brought his big, huge van that's accessible and everything. We rented a U-Haul and pulled it behind us and put his bed in the U-Haul to haul it all the way down to Arizona with us so that he could travel and be comfortable at night because he can't sleep in a regular bed anymore.
Whatever it takes.
Yeah,
Whatever it takes.
it's an
Lori?
amazing bed. I've never seen anything like it. Prior to that, they had given us some other thing that kind of blows up like an air mattress. It was very uncomfortable. This bed is comfortable. It actually has like a Roho seat cushion type insert that can go into the middle of it that would go near his tailbone and hips. So that again, to relieve any kind of pressure points, it's really amazing.
Wow. It sounds like it. And for $40,000 it should be. So
Yeah, it's an
thank you for
extremely
sharing that with
expensive
us.
bed. I was shocked that they would do that. But yeah, we're so grateful.
Indeed. Wonderful news. Wonderful to have that available to you. And we have Irvin. We can see part of you there.
No, you have Barbara.
Oh, Barbara, how are you?
I'm well. I wanted to make sure everyone else got their question in as well. And look, Alicia, lovely to see you. You know, you're my friend. I was trying to wait till everyone else got theirs in because this has been a side benefit for me when they started talking about your legs and that kind of thing. Mine stems from varicose veins, so venous. I have one leg that's larger than the other. So I was listening to hear, how to handle that and what type of doctor as well. So I've gotten some good information. So I'm going back. So this particular call was beneficial for the caregiver. And shout out to all these wonderful caregivers that I'm hearing how we support, our spouses and the things that we do for them because we love them. We want to make sure that everything goes well.
And we love you guys. We love you guys right back for doing what you're doing. Because I tell you what, I couldn't make it without my wife, and I know that I speak for the same for many of us here that we are dependent on you. And God love you for being there for us.
Well, thank you. I'm glad that I was able to get a benefit this morning as well.
Indeed, we're very glad for that. How's Irvin?
He's well. There he is.
I'm fine.
There you go. Hey,
How you doing?
hey, Merry Christmas to you.
Hey, same to you.
Good to see you.
I didn't ask any questions because everyone else answered all the questions that I wanted to ask about my ankles and stuff being swollen. So I'm fine.
Well, I'll tell you what, Nicole was a good fit because we all suffer from that that byproduct, if you will.
Yep.
And so again, for Nicole, we're so very grateful that you were able to share your time with us today. Yeah, we're getting close to our cutoff time. So does anyone have any other questions? Oh, I see Howard. Howard Pink, how are you this morning?
Okay, I'm doing well. I had a question for the group, and Jim, you and I talked about this, that I'm having more difficulty getting out of the car. I used to be able to get my fists on the frame, and push myself up and get my quadriceps engaged and lift myself out of my car. And I'm finding I have more problems doing that. I mean, I'm almost afraid to go anywhere now, because if I get someplace, I may not be able to get out of the car. But I talked with the VA last week, and they're talking about getting a medical service to come and pick me up and take me to my appointments and things. But I was just wondering if anybody had a device, because I can still use my arms to raise myself, but getting out of the car now, I can't get enough leverage from my hands on the seats or the car frame to get up. And I was wondering if there was any device I could put in front of the door. Like there's nothing I can grab or anything. And if there was some kind of device that I could put outside the car that, you know, I could, it's really hard to put my hands in front of me. I really need them on my sides. Like I finally broke down and got the VA, and hopefully it's going to come one of these days, an electronic lift toilet seat. I've had to call the fire department twice because I couldn't get off the toilet seat, and they came out and picked me up. Once I get up, I'm okay. And it's the same thing with the car, but it's getting what little I have left of my quadriceps to lift me out of the seat. And I was wondering if there was some kind of device any of you use to get in and out of the car seat if you're a driver.
Howard, I would tell you there are a number of options available to you, and I am I'm going to be having a motorized lift seat put into my vehicle in January. They've called me. We just scheduled the appointment. It's available through the VA, and there's several in the group here that have gone through what you've gone through, and perhaps some of these guys can share. Let me go through this. Carl, good morning to you. If you will unmute, there you go.
There you go. Yeah. What I have found is on a conventional car, if it has a power seat, raise the seat up as high as it will go. Other option is the VA on my van has installed a seat rotator, lift, and adjustment for forward and backward movement. And that will raise it up significantly higher than the stock position so you can get out of it.
Great. And I think that's the same thing that I'm waiting for. It's a seat that actually rotates and moves you out of the vehicle, sets you down, and then conversely, when you get into the vehicle, the seat lowers, you can sit in it, it'll lift you back up and put you in the driver's position. But my suggestion would be this: talk to the VA, talk to your primary care physician, explain to them that you need help, let them give you a referral to your occupational therapist, and it is through that department, the physical therapy and occupational therapist, that will order that for you. They'll do an assessment, and they will do that for you. So please contact them and let them take care of you as they have taken care of us. Terry Baker, good morning to you.
Morning, everybody. Talking about getting in and out of your vehicle. Talking about getting in and out of the vehicle. There's a little handle thing that goes on that post where your door locks.
Yeah, that will pass. Well, slow down. You got to move.
Yeah, and I haven't used it yet. My daughter-in-law has severe MS, and she uses that all the time. And it's real solid, real firm. It just slides on that post and gives you a good leverage point.
Well, I use that. It's called a door cane, and I use that to get into the car because my steering wheel is locked. So I put my left hand on the door cane, my right hand on the steering wheel, and I can get into the car. But I don't have enough leverage where that door cane is to lift. That's the problem, is lifting myself up. I was able to do this a couple of weeks ago, but like when I talked with Jim, I think things are starting to progress in the wrong
we get to that
direction.
disease that all of us are going to experience that.
And I'm losing the ability of my quadriceps, like when I'm on the toilet seat. I was able to get off. I have a 5-inch raised toilet seat that I usually sit on, and I was able to position my hands to push off and get up. But then, like last week, all of a sudden, I could not lift myself up, and that's when we had to call the fire guys out to embarrassingly come and pick me up.
It is a progressive disease, and sadly, that is the reality of IBM. It is that the muscles continue to deteriorate, and you're going to see more and more times that you're going to need to struggle. But there are ways around it. There are things that can help, and going through the VA occupational therapist and physical therapist is where I would suggest the journey begin. Alicia, can you? I know that you've been down that road a couple of times.
So the device is called a Bronability Turny, Turny, Evo, EVO. And it started with a referral from the primary care to physical therapy. And actually, it was the same guy that equipped Dan with his power chair. But it's Bronability Turny Evo, and it comes out. You sit down and it takes you back into the vehicle. So Dan used that successfully for years. And I have to say, Lori, thank you. I don't see you on the screen now, but Dan has a pro bed coming. It was just approved. So I'm glad to hear your positive feedback on that. And I'll tell him you're going to be scared of this at first, but you're going to love it. People haul them around in U-Hauls.
Could you repeat the Bronability thing one more time?
It's Bronability Turny, Turny, and then a space, Evo, EVO.
Okay, thank you.
Good luck
And
with that.
Thank you for that, Alicia. I know you've gone through a lot of that yourself there. Suds, did you have something to add there real quick before we close out?
George Devlin wanted to ask a question.
Oh, okay, George.
Yourself,
Go, George. Please go ahead. Unmute yourself, George, so we can hear you. George, at the bottom of your screen, you'll see your microphone there, and there's a red hash through it.
There you go.
There we go. Now we can hear you.
Jim, do you have an email? How can we go about getting in touch with you?
My email is very simply J Cressman. It's JCRESSMAN at AOL.com.
Okay. JCRESSMAN at AOL.com. All right, Jim, thank you.
You are welcome. Get in touch with me at any time, and
Okay.
I'll do my best to get back to you within the same day or the next day.
No problem.
Sometimes things get in the way of that, but I'll do my best.
Thanks for being there, everyone. I appreciate everybody's input.
Thank you for being here. And Nicole, thank you for being here today. It has been an enlightening conversation. We're very grateful for your help and your time. We apologize for the fragmentation of topics going on and off, but we cover a lot of bases, as you have now experienced. And we're very grateful for you being here. You've enlightened us to a lot of things, and we're very grateful for the time that you've shared with us. So with that, our time has come to a close, and we wish all of you a very, very safe holiday. Enjoy it. I'm here with my granddaughters here. I've got a 3-year-old and a 1-year-old granddaughter, and we're having the time of our lives down here. So right now I'm going to leave, go down and see her, have her picture taken with Santa, and then we're headed to the airport to fly back to Grand Junction. So with that, God bless you all. Love you all.
Thank
Take
you.
care of
Merry
yourselves.
Christmas.
Have a wonderful holiday to you all. God bless you. Take care.
Merry Christmas to all. Thank you.